How Dehydration Affects Blood Pressure and Dizziness. Gerald C. EclaireMD Foundation. Category: Hypertension. Description: most people think of dehydration as simply not drinking enough water, but it can do more harm than that. Dehydration can push blood pressure higher, and in severe cases, it can make it fall too low. When the body senses water loss, it tries to hold on to what is left by releasing hormones that tighten blood vessels. This blood vessel narrowing raises blood pressure, hypertension. At the same time, dehydration can trigger stress chemicals such as adrenaline, which speed up the heart and squeeze blood vessels tighter. Salt balance also plays a role. With less fluid, sodium levels rise and the blood becomes thicker, which makes it harder for the heart to pump. For people with hypertension, this adds extra strain. If dehydration is very severe, the body does not have enough blood volume to keep pressure steady. With less blood moving through the arteries, blood pressure drops. In extreme cases, this can cause fainting or even shock. Researchers also believe that living in a constant state of mild dehydration may contribute to long-term high blood pressure, and some medications used to control hypertension may increase the risk of dehydration, which makes the situation more complicated. The good news is that prevention is simple: drink enough plain water every day. Needs vary with age, activity, and climate, but a steady routine of hydration helps keep blood pressure stable. Dizziness is another concern for people with hypertension. A study in 2023 showed that a significant number of patients with very high blood pressure reported dizziness. When arriving at the emergency room, my recent stroke had both symptom of dizziness and hypertension, 175 millimeters of mercury. High blood pressure is often called the silent killer, because most people do not feel it, yet it damages blood vessels quietly. In some cases, dizziness, headaches, chest pain, or nausea can occur, but the only reliable way to know is through regular home monitoring. High blood pressure reduces blood flow to the brain, which can cause lightheadedness or fainting. Dizziness may also come from other causes, such as sudden drops in blood pressure when standing, side effects from medications, anemia, or inner ear problems. If dizziness appears along with high blood pressure, it is wise to see a doctor. By itself it may not be serious, but in combination it may signal greater risk, such as stroke. High blood pressure is common and often hidden. Staying hydrated, checking blood pressure regularly, and seeking medical advice when needed are the best ways to stay safe. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.